Hello and welcome to the fourth educational mini-series provided by and presented by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Manager of Community Outreach and Education for the agency. This fourth mini-series topic is on aging programs and services. We have 4 series within that one series topic, and today's segment is on community services. My first guest today, I'd like to introduce, is Dot Hartman, and she is the Vice President of Community-Based Aging Services with Berks Encore. And welcome. Thank you so much for being here, Dot.
Thank you, Ann, for having me.
I wanted to get right into our program today. We've tried to come up with a few key community services through the Berks County Area Agency on Aging and provided to the community through the provider, in this case, Berks Encore. The first program I'd like to talk about, because I think there can be some confusion, although we recognize the name, we want to clarify some information on the program. And the first program today is on Meals on Wheels, or home-delivered meals, you may also hear us refer to it as. So let's start right in on the Meals on Wheels program, Dot, with, I guess, the intention of the Meals on Wheels program. Why is it out there? What is it here for?
Okay. Sure. Yeah, home delivered meals is established to provide a hot meal once a day for anyone that is homebound, over age 60 and homebound, meaning they don't have family living with them, they don't have family supporting them, and it's hard for them to get out to get groceries or to cook for themselves. It is free of charge. It's offered on a donation. Really the only requirement is the age 60 and homebound.
Okay, so, and that covers, we're talking specifically here in Berks County in
Right.
terms of our program here, but the general requirements is somebody who is age 60 years of age and older through this particular home delivered Meals on Wheels program. And you mentioned homebound. Now, I know that's kind of also a questionable term because we may get some calls from folks who will say, well, I am and I'm not. I know that some people who have limited ability to get out might be considered homebound, but what if there's always that, well, I have to see my doctor?
Yeah, certainly going to doctor visits is expected, and hopefully they are getting out to doctor visits. So yeah, it's really the ability to get out and get groceries. If they are able to get out, we encourage them to come to a center for a meal instead.
Okay.
So we always have that conversation with them, you know, what is your access to being out?
And some of
you
the
know?
options. Perhaps they
Right.
didn't know that there were senior centers that they could go to
Right.
and have the means, the transportation means, to get to a center, which also helps in socialization and some other activities
Correct.
in addition to the hot meal that is provided at the center.
day.
And we're going to talk a little bit later about senior community centers. So if we have a 60-year-old and older who is homebound with limited abilities to get out or can get out to doctor's appointments but can't get groceries, can't prepare a meal,
Sure.
then their access to learning, well, who do I call? Hey, that's me, who do I call? Who can I call then to get more information?
Sure. Yeah, people can call us themselves, and they would just call the Berks Encore number, the 610-374-3195, and say that they would like to sign up for Meals on Wheels. Oftentimes people are referred by doctors' offices, or maybe
Okay.
if they're being discharged from a hospital. We get a lot of referrals when someone's leaving from a hospital stay, and the social worker there feels that they would benefit from someone providing meals for them for a period of time.
Okay.
So it can be a referral from family, from friends. It can be a self-referral. The quickest way to get on is to have a doctor or a hospital call. If it's a self-referral, we still usually are able to start within 2 days, but we would have someone come visit pretty on short notice to make
Okay.
sure that it's an appropriate referral.
And so that's when you were saying referral, here's somebody that they've kind of seen that could benefit from that program. But I'm understanding then that there is a more formal assessment, would you call
Right.
that, to determine if that
If they
person
are indeed
really
eligible,
truly is
right.
eligible. Okay, can you tell us a
Right.
little bit about what happens at an assessment?
Sure. Yeah, we have a care manager that will come out and visit the home so that she can see the setting and obviously the mobility of the person. We often ask that a family member can be there to help provide some information, because sometimes seniors, their view of reality is a little different than what a family member would see.
Or, and again, I can understand if I've also just come out of the hospital,
Right.
I'm not quite up to par, and I
Right.
may be forgetting some questions or something that you're asking me. Okay.
So we would go visit, and there is a pretty lengthy questionnaire that we do go through. But it does actually generate a score that says whether or not they should qualify or not. So it will look at the different aspects of their health, of their nutrition, of their mobility, and then kind of say, yes or no. But then it's also a human factor involved there. So our care manager can still, if she really feels like it is necessary, even though the score was close or maybe wasn't quite high enough, then we would keep them on the program. But
About how long might an assessment take that I could expect somebody to come and do that in my home?
Yeah, I would say a half an hour to 45 minutes.
Okay.
For the initial visit. And then we do a follow-up at 6 months, and then again at a year.
To just make sure
just
that
to make sure.
things are going well for
Right.
the individual in the program.
Yeah.
When you mentioned, so in knowing that you can do the 6 month or the year follow-up, but you also said sometimes it's a short term. Can you tell us what that might be and what the circumstance might be surrounding somebody on a short term versus a longer basis?
Yeah, with someone, especially when they're being discharged from a hospital stay, we'll have a note to call in 10 days. So they get approved for 10 days following the hospital stay. And at the end of that time, someone will actually just call and say to them, do you think you would benefit from having it anymore? Or not. And if they say yes, then we would most likely then go out and do that initial assessment.
So it's kind of a quick stopgap kind of measure for that connecting time from a discharge to a determination based on what their situation is.
And oftentimes people might even call and cancel before the 10 days if they feel like they're able to take care of themselves. But, yeah.
And could you tell me two more things? I guess one is how often time of day that one receives the meal?
Sure. Initially, Meals on Wheels was just Monday through Friday, at basically for the noon meal, although typically volunteers will show up anytime between 10 and noon. Okay. So it's all volunteer delivered, so there is a little bit of variety there, depending on someone's schedule. We can offer a weekend meal now, so it's a cold meal.
Okay.
It's still something that can be heated up. I mean, it's not just a sandwich.
Okay.
It's just something that could be heated up in the microwave. So we ask them if they would like the weekend meal or not. Not everyone gets a weekend meal, but a number of people are doing that. So on Friday they would get their Friday meal along with the weekend meal.
Okay.
But it is once a day, and then we always have our blizzard packs, which we used a lot this year. Again, given that it's delivered by volunteers, snow days,
makes it difficult.
We often have to call off. So we make sure they always have something in their pantry that we provided that could be used. Whether or not it's still there by the time they need it is up to them. But yeah, we do always provide some pantry items that can be used, can of soup, that kind of thing, applesauce, that they could have.
Providing them some good nutrition to get through to the next day. Or to another meal that they might be getting from someone. Okay. Right. And now cost is always a factor in terms of questioning, do I pay for this meal that I'm getting?
Right.
How does that work?
In Berks County, and counties will be different, but in Berks County it is all free of cost. So we will take donations if people want to give a donation, and many of our people do.
Is there a suggested fee? Because I may not know what the cost of the meal actually is. Is there something that you could recommend that helps me determine whether I can afford that, or the amount that I want to give based on how much I received?
You received, yeah. I'm going to say about $2 a meal, but that I know that's kind of what they suggest at the congregate meals.
Okay.
So I believe that's roughly.
But I can base that loosely, and then I can get it Monday through Friday, or maybe if typically people need it 5 days.
Yeah, oftentimes it's 5 days, but if you, we have situations where people are out maybe for dialysis a couple days a week, so you can certainly say Monday, Wednesday, Friday, whatever days you want, and of course if you know for some reason you're not going to be there a day, you go to visit family or something, you just call. We ask that you call and let us know you won't be there, because we do worry if we go to the house
Sure.
to deliver and someone's not there. So we do ask that clients let us know if they're not going to be home. If there is a situation where they're pretty far out from any of our established routes, we might ask them to do frozen, where
okay.
we would have frozen meals delivered to one of the centers, and then someone could come and pick those up either once a week or once every 2 weeks. Maybe a family member could come do that, or yeah, so that if someone's really rural, we might try to work something out.
Well, at least we're trying. I mean, it sounds like the program really tries to access those folks who are really in need of a good hot meal, and to make some accommodations to get it to them.
I mean, the fact that we deliver almost 100% hot is pretty unique, again, and a lot of counties, they do a lot more frozen because of the nature of it.
Well, and I know that it takes a good number of volunteers to hit all of the routes that are out there, and we've got such diversity from the center city Reading routes all the way out to the outlying parts of Berks County. So I will put a little plug in to that any folks that are out there thinking about wanting to do some sort of volunteer work, to give Berks Encore a call to add to their volunteer pool. And I know that there's varying opportunities to participate as a volunteer, and they can you can give them the details that we won't take up now, because I'm sure that this is generating some other questions as far as the recipient of the meal or a volunteer of the meal. So I just wanted to let folks know that that is one of our community service programs out there, to make you aware that you can receive a nice home delivered meal. The next program that I know Berks Encore is quite, I almost said apprised on, quite informed about, and runs a great program. It's called the Apprise Health Insurance Counseling Program. And Dot, you can tell us most. You're responsible or oversight of the Apprise Health Insurance Counseling Program.
Yeah, Apprise is actually the name of the state program for Medicare counseling. Every state has free Medicare counseling, and in Pennsylvania they call it Apprise, which is just indicates we're here to let you know about your Medicare benefits and your options.
So it's the only word that doesn't really, it's not really an acronym.
It is not an acronym. It doesn't stand for anything other than we're here to let you know.
To apprise
to
you.
apprise them, so it's, every county has a program, and it is run by staff and volunteers, because we do serve, obviously we have many Medicare beneficiaries in Berks County, and we help with people just starting Medicare. We help with people already on it and looking to see if they can change their plans, and especially during open enrollment, we saw over 1,500 people. So we obviously can't do that with three staff people. So we do have many volunteers that help us with that, and with the volunteers we can get out to our senior centers as well. So we're getting out around the county, meeting with people throughout the year.
So I'm going to interrupt, because you said two things there. You said about the open enrollment period, but then you just said throughout the year. So the Apprise program does operate year-round. It's not just in that period of time with open enrollment. So maybe you can distinguish the two. Tell us about just briefly how it helps with open enrollment, and then throughout the year.
Sure. Well, so throughout the year we're hitting people that are just starting Medicare. Because as you turn 65 or leave an employer's job and are over 65, you have an opportunity to start Medicare. So that is going to be any month that it's appropriate for you. So we're helping people all year long with that, as well as people people that have a need for financial assistance and either want to get enrolled in that or already have it. They have an option to change their plans throughout the year. So there are people that can change even if they've been on Medicare for a while during the year. And then the annual enrollment time, which is October 15th to December 7th every year, is the time when plans change, and so then consumers have the chance to change plans if they want. And I was just doing, our calculation for what we did during the open enrollment this past October through November, and it was, we saved people, people that change plans saved on an average of $800 a year.
Wow.
So it really is a smart thing to look at it, even though you're happy with your coverage. Your plan will change some, and other plans change, so you don't know if you have the best coverage or not. So we just help people look at all the options. We do not sell, Apprise does not have an insurance plan. We don't sell anything. We just let you know all the options, what the costs are. We can help you compare it to an employer option, a retiree option, We're just there to give you information and cost information.
And in order to make that comparison or have a good session, what would the consumer, what would the individual come to you with? What kind of material, what kind of information are you looking for when you do sit down to make some of those comparisons and look at costs?
We always ask for them to bring their Medicare card in, just because that way we can look them up on the Medicare.gov and make sure we know what programs they have already. Because if sometimes people don't know that they're getting assistance in different ways. So that's always helpful. And if we do want to make a change, we have to have that information to initiate a change in enrollment. So their Medicare cards, a list of their medications, doctors that they see, because there are plans that are that have networks of providers, and so we would want to check that with the people.
Before you make a change.
And income information, if they're feeling like they might qualify for some assistance, we would, what their monthly Social Security is, that kind of thing. Usually we know coming into the appointment if we're going to do an application, we would be more specific in what they have to bring for certain financial applications. But in general, it's list of drugs and doctors, and just we will ask you about how often you see doctors and your health, just so that we get a feel for what your insurance needs might be.
And I would assume then that it's wise to make an appointment as opposed to just popping in
to
make sure that you have enough time
to go over all that. It's pretty rare that we can handle walk-ins, so appointments are always recommended.
And would you give us that number again as to how they contact you at Berks Encore?
Sure. It's 610-374-3195, and just let them know you want to speak with a Medicare counselor. We do have bilingual staff available. If you're listening to this and know of someone that needs help in Spanish, we can help with that.
Good. And again, I guess I'll do another volunteer recruitment in that you said it's staff and you have volunteers. So
we have a pretty a nice training program. It's online for a lot of it, and then we do have a 3-day in-person classes, but that goes on all year long. So whenever you are feeling like you might want to help out with that, if you're retired and not too many people seem to have an interest in insurance, but if you do, it's very...
Perhaps if you had past experience, you're certainly a little bit more knowledgeable than others.
It's very, very rewarding, I will say that. People are so grateful because insurance is complicated, and so when you can help them figure something out, they're very grateful. And to save money, they love that.
Perfect. And the third thing that I really think that I'd like to make sure we hit real quickly is another program of Berks Encore called Berks Encore at Night. And so exactly what that is, Dot, can you tell us what is that, where, et cetera?
We've started doing this a couple of years ago. So what it means is that we have, every month we have a session at St. Joe's in the hospital there off of 183. We call it Burnville, but it's Leesport, whatever. Not in Reading, but outside
hospital
Reading.
Site.
Close to the airport. So we run a session the second Thursday of every month, and on an aging topic. We do powers of attorney, we do retirement planning, we do Medicare, we do long-term care insurance. So we have a schedule.
And where would I have access to? How would I see that?
It's on our website, www.berksencore.org, as well as in our monthly newsletters. And those do come out with the Reading Eagle every other month on the first Sunday of the month.
So it's a supplement within the Reading Eagle. It's a whole separate newsletter.
Or you can always just call our office too.
And they can get all kinds of then educational opportunities and look at the run that's the most appropriate for what their need is. Great. I'd like to move along a little bit and move to another community service that we touched upon here in our conversation. It is on our community, senior community centers here in Berks County. And I do have a listing of them, and I think I'll show it now if we can. We have 6 different locations through Berks Encore, and as you can see on the screen, there's one in Birdsboro, there's one in Fleetwood, there's one in Shillington called the Mifflin Center, there's one in Center City, the Reading Center, Strausstown has a center, Berks Encore Strausstown Center, and of course one in Wernersville that is on the site of the Wernersville State Hospital. So they have 6, and then I'm going to scroll down here to the next grouping. There is one at Family First Resource Center on South 7th Street in Reading. And they also operate what we call SCWOWs, or Senior Centers Without Walls, and we'll talk about that in a few minutes. Also, we have Centro Hispano operates the Casa de la Amistad Senior Center and the Senior Center at Kennedy Towers, called Kennedy Senior Center. And last but not least, in the Boyertown area, the senior center is called the Center at Spring Street in Boyertown, and it's part of the Boyertown Area Multi-Service Company. So I think that's great, and I wanted to, actually I'm going to leave that second sheet on as we introduce Willie Mae Brockington, and she is the Outreach Director for Family First Resource Center. And welcome, Willie Mae. Thanks for being here.
Well, thanks for inviting me.
I want to take a few minutes to specifically address our senior community centers, and I will mention that, as I did on the screen, Berks Encore has 6 sites. And you can contact Berks Encore or any of those site locations. You will also see all of these senior centers listed on our agency, the Berks County Area Agency on Aging's website, which is www.berksaging.org, and you will see a list and can look up those specifically. And so today I want to just spend a few minutes on the Family First Resource Center. Tell us a little bit about your center activities.
Our center is located at 416 South 7th Street. Our telephone number is 610-372-7488. We're open from 9 a.m. to 2 p.m. daily, Monday through Friday.
Okay.
Unfortunately, we have no weekend hours at this time, but we are a growing center, and we're looking forward to establishing other things. Okay. We do a variety of things with our seniors. One of the big things is we like to take excursions and go on trips.
Which is really different, Willie Mae, because I know that some of the other centers, it's typically the activities that happen at the center location. So you're kind of branching out from there. So tell us about some of those excursions.
Well, that has to do with us having a senior center without walls, and
okay.
because we're normally branching out, as you put it, and going different places, it just seemed to fall in line to do the excursions. One of the things that our seniors really enjoy is the casino trips.
Oh, okay. Who doesn't?
So we do the casino trips.
Okay.
We go every other month to a casino.
Oh, all right.
And then we have what we call a mystery trip that we do the opposite months that we don't do the casino. Now, the mystery trip is just as it sounds. We're not going to tell you where you're going until you actually go.
So we're kind of captive if we agree to go. Okay.
Yeah. Our latest mystery trip, we went to Hershey World. And that was interesting because it took the seniors back to a time when they used to take their kids out. They brought back great memories. And it was a fun day, which will lead me into, because we do the casinos, part of the educational program, that one of the things that we do educationally is we do gambling awareness program. Okay, we figured since casinos really push senior gambling.
Okay.
Our seniors need to be educated and know some of the things they need to watch out for. So that's one of those interesting programs that move with our senior center without walls.
Now, and let me just ask one question about the excursions. They're typically in that one-day period of time.
They're typically a one-day excursion.
Okay.
We normally leave maybe 9:30 in the morning, and we're always back by 4 o'clock in the afternoon.
Okay. So now let's flip hat, and as we do some more things, we were talking about the Senior Centers Without Walls.
Okay.
Tell us what that means.
It's Senior Centers Without Walls, and basically what it means is that we're reaching out to engage the seniors that don't have access to the stationary senior centers, such as Berks Encore.
Okay.
You've got the seniors that she mentioned in the Meals on Wheels that are homebound. If they're living in a community where they can, say, come down to a social room because they're in a high rise, those are the partners we're looking to partner up with so that we can bring presentations, even crafting, entertainment to the centers there. And that's why it's called Without Walls.
I was going to say, so in effect, you're offering some of the basic
senior center
opportunities
of
senior centers that are offered at senior centers without being at the location of a senior center, but at one of these
Exactly.
squads. Give me, if you can, a
couple.
mention of a couple of sites.
A couple of the sites that we have, we go out to the Bethany Lutheran Church out on Carsonia Avenue in
okay.
Exeter.
Oh, okay.
We're also going to the St. Catherine's Apartments in Mount Penn, the Queen of Angels Apartment at Temple. We've got the Rhodes Apartment here in Reading at 8th and Franklin Street, the Hubert Apartments on North 10th Street, and we go out to Jamestown Village Community Room also for people in that area.
So in all of these, you have some kind of educational program,
Yes, ma'am.
Or maybe a craft, as you said,
Craft.
and then
Or entertainment even.
entertainment. And
we've-
there's a meal as well, right?
Definitely. It's,
Okay.
it's
Another-
called a congregate meal
Okay.
provided by the Area Agency on Aging.
Okay.
And it is at no cost to our seniors. And as was mentioned earlier, we do accept donations, of course. Some of the entertainment has been really interesting because we partnered with the Reading School District at an event that their Reading School choir came in and gave us a preview of something that they had just done called Smokey Joe's Cafe.
Oh, okay.
And so we had a preview of that, and that was really interesting. And it's type of entertainment like that that we do provide for our seniors at the walls, without walls.
And so tell us one more time, how
Yes.
do I find out about these opportunities through the Family First Resource Center? Is that correct?
Yes, ma'am. And
And
we're
that number
located
again?
at 416 South 7th Street if you would like to drop in. And our
Okay.
telephone number is 610-372-7488.
Terrific. For more details about what's happening at that location as well as the other locations that we mentioned here briefly. Terrific. And one other program I'd like to take a few minutes to share is called Primetime Health. It's health education, disease injury prevention programs that we offer here in Berks County through our Area Agency on Aging. Right now, we have 3 what we consider evidence-based programs through the State Department of Aging. And I'd like to mention that they're Healthy Steps in Motion, and I always think in motion, which is the exercise class. And Healthy Steps in Motion exercise class, the folks receive it's actually a calendar, a wall calendar, and you will see, let me just show you if I can find quickly an exercise. You will see, if you can, that there is an exercise demonstration. So when you attend a class, it is typically twice a week at a location. You also get this so that when you leave the class, you know how to do that exercise at your own time in between classes. We have a variety of those classes in Berks County, and again, you can contact our agency for the location. The second program that we have is called Healthy Steps for Older Adults. It is actually a falls prevention class, which means that it's about a 4-hour program. We can split it into 2-hour sessions. We talk a lot about aspects of falling and certain pieces that come into play. Might be medications, it might be nutrition, might be footwear, and also we provide 3 physical skills screenings that we test your risk for falling and then do some demonstrations of also exercises that you can do on your own in your home, and you get a participant workbook. The third evidence-based class is Chronic Disease Self-Management. It's a 6-week class. It's 2.5 hours each week. You also can receive a participant book when you attend the class. We talk a lot about not the chronic condition itself, but how to better manage your chronic condition or conditions. It's tools and tips and techniques for stressors, relaxation response. It might be better eating. It might be how to talk with your family or your physician about how you feel. It's a nice group of sharing information, and we do a lot of planning on getting something specific done for yourself and help to better manage your chronic condition or conditions. For all of these classes that are held here in Berks County, I want to let you know to call the Berks County Area Agency on Aging at 610-478-6500. And in fact, we have a class starting very soon, and so we will have ongoing classes throughout the year, so please give us a call. I want to thank you for tuning in to this segment, and we talked about community programs and services, and thank you for joining our program.